Hello, everybody, and welcome to episode 9. So excited for my guest today. She's just the best and so much fun. So I'm going to go ahead and add her now, and we can get going. Oh, trying to type. Here we go. All right. So I'm hoping that everything works out okay and that we can get Carly connected here. Hold on. Oh, join. Yay!
Hello.
Hey, technology success. Awesome. Thanks so much for being here today.
Thank you. And how lucky are we? 2 visits in less than 24 hours?
Oh my God, I know. Let me do a little intro about you and then we'll tell everyone where we were last night, okay?
Sure, okay, sounds
So
good.
everybody, this is Carly Hickey. Besides being a pure delight as a human being, there are some other cool things you should know about her as well. So she's a registered nurse and in good standing with the College of Nurses of Ontario since 2010. I know she does not look like she could be that old, so there you go. She worked for 12 years with adult intensive care units and also in 7 ICUs across Canada, and currently works in a neonatal intensive care unit as a lactation consultant at a large hospital. That's cool. I didn't know that about you. She has cared for severely critically ill patients with a wide range of injuries and illnesses, which is definitely what we're going to be chatting about today. And then in 2022, ACE Planning Company was founded and launched in 2023 to help families proactively prepare for a medical crisis and or for health frailty. She's also a proud wife to a doctor and the mother to 2 beautiful children, William and Scarlett. And as I'm thinking about it, I'm pretty sure I know someone else who has children named William and Scarlett as well. So there must be something about those names. So welcome, Carly. Thank you so much for being here.
Oh, thank you for the very generous invitation. So happy to spread this message.
Awesome. So before we dive in, we should say that today is April 17th, which is just a day, but yesterday was April 16th, which for you and I is like the day that we plan, I think, our year around because it was Advanced Care Planning Day and we were lucky enough to spend it together. Why don't you tell everyone where we went?
Yes, so we were downtown, we were downtown at an event for Dying with Dignity Canada, and we had the privilege of engaging in a fireside chat with 2 physicians who wrote a book called Hope for the Best and Plan for the Rest. And they are on a mission to spread awareness about the value and power of advanced care planning and really looking upstream to a proactive approach to healthcare and decision making rather than what we're all experiencing now, which seems more like a Band-Aid reactive type of model. And their specialty focuses on palliative care. So they were just such warm professionals, and it was moderated by Dr. Jeff Myers, who is also just such a wonderful human being.
It was really like considering, it's like a Tuesday evening and you're like, yeah, okay, I guess I'll go to a Dying with Dignity event. It was actually like pretty fun, like surprisingly. I mean, we were together, which I think helped, but also I found that all 3 doctors up on stage were just very natural and fun and made some jokes and were also very honest about the Ontario and for that matter Canadian medical system, and instead of being, I think a lot of times the way that we as lay people, non-medical people, so I'll speak for myself, see the industry as doctors being up on pedestals, not being that approachable, giving us limited information. These doctors were just word vomiting it out and like just giving us the deets on how this world works and ways that we as individuals and as organizations can support and influence a change.
Absolutely. And really bring warmth and approachability to such a difficult conversation that many people have. And I'm really excited to be part of this conversation because if we pull down those barriers and make it a little bit more accessible, I think we're going in the right direction. And they certainly started with that.
For sure. You also did a great job of recapping. You used some of their like language that they have in their book. So I feel like we need to make sure we share this with them because you're a good spokesperson. So good job. All right, we're going to dive into...
I'm a fangirl, as you said yesterday.
Totally fangirling. I was like, you're like, oh my God, that's blah, blah, blah. And I'm like, all right, whatever.
Yeah.
But you were very into it. You were very into it. Well, you're also from the medical side of things, right?
Yeah.
So I feel like you know who these people are, but I'm excited to know them now as well. And I think we really should start our book club so that we read more industry related books, you know?
Agreed, agreed.
Maybe we should slip in some beach reads in between just to like cleanse the palate. Okay.
Sounds
All
good.
right. So we have some questions that we're going to go through. So let's dive right in here. So I want you to tell us a little bit about the work you do. How did you get into advanced care and emergency planning as your primary line of work?
So I started in the intensive care unit after nursing school. I fell in love with it during my consolidation, which is our last placement in nursing school, and just knew that the IC was where I wanted to be, and had the privilege of, starting out my first couple of years, really getting, grounded in the specialty. But soon after, I started realizing that things felt very reactive. It felt like we were coming in too late with our approach to care. And as a result, families had really high expectations about the results that the ICU could provide.
Right.
And, sometimes, expectations that were just not in alignment with where the patient was at. And specifically referencing, we're looking at an end of life situation rather than restoring life.
Right.
And I believe that when I started out, I innocently thought that the ICU was a place where we gave people a second chance at life. And, we try to return them close to or to their baseline of health. If they were in a car accident, completely independent, we get them back to where they were. And we don't leave people in a state that they're going to be suffering in. And I quickly realized that that wasn't always the case. And that created a lot of moral distress in me, where you knew somebody was never going to get off a breathing machine, or they were never going to shower themselves, or they can't communicate with their family. And the question that nurses, doctors, social workers, OTs, PTs, pharmacists, everyone would ask is this what the patient would want? Is this what they would want? And when we knew if there was a document that said, yes, do everything to keep me alive, we could do that. We could provide that care. But when the conversation was never had, and you have this very loving family, and all these decisions come from love, whether it's to keep somebody alive in that state, they don't want to let go. I completely understand that. It just made it really, really challenging. And committing somebody to a life in ICU or a hospitalization comes with long-term intravenous access, bed sores. No matter how great the nursing care is, if you're sedentary in bed, you get bed sores. X-rays, pneumonias, blood clots, you name it. There's all kinds of different things. And so slowly, as my career progressed, I realized, oh my gosh, like we are not prepared for the sophistication of technology that allows for these types of heroics to occur. And so I kind of sat with that and talked with my colleagues who we all pretty much felt the same way. When we could resuscitate and get somebody back to where they were, it felt really great. But when we couldn't and we were causing more suffering and harm, it didn't feel good. And then in 2015, I went from having a professional experience to our family's experience as a patient. So my father-in-law very unexpectedly passed away in the ICU in his 60s. And then 18 months later, my stepfather passed away very unexpectedly in his 60s. And to have two ICU professionals like myself and my husband go through that and experience what it was like to walk a day in somebody's shoes who goes through this unexpected health crisis, not once but twice, we really had the sense of, oh my gosh, if we went through this, so many more people are going to go through this, and we really need to prepare the public for what's to come.
Right.
And luckily, we were able to, work with our families to make decisions that were in alignment with what our families would have wanted. But there are so many risks when families aren't prepared. And so we were just very lucky to have, strong connected families to go through that. And so the pandemic happened, and that's what catalyzed this mission.
Right. I feel like, depending on your generation, which medical show you watch, so like MASH or ER or Grey's Anatomy, right? Or Scrubs or whatever, it doesn't even matter. Like, it's just, they do a good job of making certain things look very real. I've heard from doctors, they do a great job of that. But you either see a character die or you see a character live. And when you see a character live, even if they look a little bit weak when they're leaving the hospital, in your head you go, oh, they're better. this was someone that Meredith Grey saved. Great. Like, you don't actually think, they don't show that middle part. They don't show the being alive, but not actually being really yourself anymore. They do a good job of avoiding it, probably because it would just, keep storylines going on and they don't have time for that, right?
Yeah.
But I think that because the vast majority of the population has no idea what actually goes on in an ICU, and we're getting all of our medical information from dramas on TV, we have no idea what it means, right? We don't know what it means to have a feeding tube, to have a breathing tube, to have CPR done to us. I've had the Heimlich maneuver done to me. It's not like fun. I'm pretty grateful I had it done and I'm alive, but it hurt so much if it's being done well. Like, we don't know what these medical interventions mean long term. We know that they have the potential to save a life, and that's great. And depending what age and stage we are in life, we might choose to still have them or we might not. But I think a lot of times we're making decisions based off of a lot of ignorant information. And it's unfortunate that that's not being made more accessible. And what I think is great about your organization and other people in the industry is that you're trying to create that education. Like, this is what CPR means, not just I pound on your chest a couple times, maybe we use those paddle thingies and then everything's great. That's not what's going to come from that situation, right?
For sure. And, I love spreading the word about the importance of CPR, but there is a certain population that you can try, but it doesn't create the same effect. It doesn't restore good cardiac function. And, some people in the industry would say CPR is for young, very healthy hearts. And so when you're getting into, late stage just life, 80s, 90s, you don't have the same type of heart that you had. It's a muscle. And, if plaques develop or there's heart damage or anything like that, all of these things must be accounted for good restoration of CPR. And to give good CPR, you don't necessarily have to break ribs, but it often happens as a result, because in addition to that stage of life, people have, frailty with their bone density and other things. And, you can get lung punctures and brain bleeds and all kinds of other things. So even surviving CPR with a optimal outcome can be challenging. And,
Right.
And to your point, and what they referenced last night is, advanced care planning isn't about a tick box about, yes, I want dialysis. No, I don't want dialysis. I want a feeding tube at end of life. It's the why behind it.
Yeah.
It's understanding, when you get to that stage of life, what do you want that life to look like? And to the point that they had made last night about breathing tubes, you could have a breathing tube for an elective knee surgery. But if your family says, no, I don't want to be on a breathing tube, that doesn't hold you back from getting that knee surgery. That's a very temporary measure, or a very, temporary pneumonia that just, you need a couple days on a ventilator to get you, through it. And then you can go right back. But if we're looking at catastrophic, injuries from a car accident or, burns or anything else, it's what does that person look like on the other side of that critical illness? What are they going to be leaving the hospital with if they leave the hospital?
Right.
And, how would they want to live? Would they want to be cleaned every single day, or stooling on a commode or in a diaper?
Yeah.
And how would they want to be visited like that? It's hard to know. But giving families a benchmark for that conversation often makes that decision making a little bit easier. Not a lot easier, but a little bit to go off on.
Yeah, I think it was interesting last night. One of the doctors, Dr. Sammy Winemaker, who's a palliative care physician, was talking about going to get her will updated with her husband, who's also a doctor. I believe she said a surgeon. And the, lawyer, not a lot of lawyers will do this, but this lawyer, which is great, at least had the forethought to ask, would you like these medical interventions done? So he was probably working on their power of attorney for personal care. And so her husband went first and said yes, no, to whatever. And then the questions were directed to her. And with each response, she said, well, I don't know, it depends. Well, I don't know, it depends. And she had said, the lawyer probably thought, oh God, she just doesn't get it. Like, she just doesn't get what I'm talking about. But really, she's making a really good point. Like, it's true. Like, do I want CPR right now? Yeah, I'm 37. My heart is healthy. Like, let's freaking fight. Let's do it. Let's see what we can do. But my husband and I have talked about, ventilators. Like, how long am I in a coma before you just pull the plug? Like, and it isn't just about me. It's how long do I want him and my daughter and my parents to be in limbo, wondering if I'm going to wake up, right? It's taking the time to reflect on things that we don't want to reflect on. No one wants to do this planning, and that's okay. There's a lot of things we do in life we don't want to do, and that's fine. But it is taking the time to think about your own mortality and also what life you want. Because it is okay to not want a life with X or Y. That's okay. To you, that might just sound like the worst thing in the world, and you'd prefer to not be alive if this was the case. But every person's so different and so personal, and how can we expect someone to know what we want unless we explicitly start going through scenarios and saying what it is?
Absolutely. And, to your point where you mentioned that advanced care planning is about the patient, I absolutely agree. You can really determine what it is that's important to you, how you would want your healthcare directed if you're not able to speak for yourself. But being an ICU nurse and working with patients who are sedated, I didn't interact necessarily personally with the patient. I worked with their families, and seeing the grief, seeing the stress that the families experienced, not to say that the patient isn't suffering, but when they're sedated, like you're focusing on the patient, but you're also taking care of the emotions of the family.
Mm-hmm.
And so I feel that an advanced care plan, if written correctly, can do wonders to help guide that family through
Yeah.
this horrendous storm of grief and stress and lack of preparedness. And that's my mission, is to, you never want to have to go out and buy a fire extinguisher when your house is on fire. You want that fire extinguisher in your home ready to go, and you want to know how to use it. A
Yeah.
lot of people, they fumble, they don't know how to pull the pin, it might be expired,
Yeah.
and all of these other things. Or you might use a fire extinguisher for an electric fire, but it's for a grease fire,
Mm-hmm.
right? So it's all these little things that people think, oh, I don't have to be prepared for, but in actual fact, we really
Yeah.
do. And it's a gift that keeps on giving, because your family will never have to wonder for the rest of their lives if they made the decisions that was what you would want.
Exactly. Exactly. And I think you kind of answered my second question about what are the risks if you don't have it. I think the risks, well, the first one is obviously that you might not get what you want, right? So there you go. But I think in some ways, especially if you end up dying, really the risk is what your family lives on with. The grief, the loss, but also the guilt, really, right? Did I make that right choice? I know lots of people who have said that to me. They're like, we made this decision, me and my siblings, we have no idea if this is what dad wanted. And like that's just living in the back of their brain for the rest of their life. And people within families, just because you're a family doesn't mean you think the same way, right? And so making sure that you know exactly what mom wants in these scenarios, and then you and your sister have differing views, but you're able to do what mom wants because mom detailed that out. I think that helps to remove any potential family strife as well, right? And the separation of a family unit over the loss of a loved one. So I think we've kind of answered number two, which is awesome. But let's dive into the third one here. So you work with individuals and families who are in a variety of situations. Now, sometimes people come to you and they're in good health and they're doing what I like to call the vitamin approach. They're coming in and they're planning very ahead. Other times you could be working with people who are in the thick of a serious illness. So they're just looking for straight up medication, right? Like just do what you can. And you and I both run vitamin businesses. That's what I say. We offer painkillers, not legally, literally, people, just to be clear. We don't sell any medications of any kind. Just making that clear. But no, we have painkillers available if needed, but we are all about the vitamins. We're all about planning ahead. So how does advanced care planning, how does that process change depending on what kind of a situation a person's in when they come to you?
Yeah, so I think, I guess the root of it is advanced care planning is planning for care in advance of a situation. And what I typically see is I plant the seed of advanced care planning with clients, but then they call me in crisis to continue on with the care planning procedure. And
Yeah.
so it's that stimulus that gets that going. And when you're having these conversations, sometimes they're in the nick of time, and sometimes they're a little bit after. But
Yeah.
um, typically, the literature around advanced care planning suggests people who have been diagnosed with terminal illness and things like that. But I felt that in ICU, there were things that with a proactive health promotion approach, you could really get ahead of and really focus that upstream care movement. And so I think that if you start in your 30s or 40s, when you're young and healthy, not to say that everyone is in good health in their 30s or 40s, but just for the majority of the population, um, you know, advanced care planning includes estate and financial planning. We really have to think about our finances as we go into retirement and making sure that we have enough to pay for the care that we will very likely need in our most frail years. Your frail years are your most expensive, regardless of how much you take care of yourself. And so, estate and financial planning is very, very critical, and that includes preparing your final will, so that you don't die intestate, and deciding who will be your decision makers. And in Ontario, it's power of attorney for personal care and power of attorney for property. And and with that, with the ACE planning company model, as a registered nurse who is committed to health promotion, I factor in, making sure that my clients have access to care, that they have access to a care provider that they can communicate with, because there have been patients who came to ICU who said, I had a doctor, but I didn't go to him because I couldn't speak with him. And so really trying to find the right access for the right patient can really make all the difference in somebody's health longevity. And so I definitely parcel that in with, somebody who is not near end of life, but looking for health promotion as well, and coordinating them with professionals and health experts that can help optimize their quality of life.
Mm-hmm. Now, last night I know they talked a lot about our healthcare system, and I mean, we are in many ways blessed by the fact that we have free healthcare in Canada. I mean, pretty awesome. Don't have to worry about a lot of things. You get cancer, yeah, there's things that you have to think about, but you're not thinking about paying for chemo. Like, you're not, and that's pretty sweet. That's pretty great. But like any model, whether paid, hybrid, or free, there are issues. There's just always going to be issues. It's tons of people trying to get through a medical system. Now, healthcare navigation, and we'll speak particularly in Ontario, I mean, there's actual people who now help you to navigate the system. There are courses you can take. I believe there's one at York University that teaches you how to be a health care navigator, because it's just become so difficult. And I think we're going to see it become even more challenging as the boomers become actively in their aging years. There are some now, but not as many. We're going to see that in the next 10 to 15 years, because the system is going to be inundated with people with health issues. Maybe not life-threatening, but still significant enough, and it's going to bombard the system. So if you have an advanced care plan, how does this help you in navigating such an overwhelming healthcare system?
I think that it allows you to think ahead as to what it is. You're not deciding in the moment of a
Mm-hmm.
crisis, just like you're not going out to Home Depot to get a fire extinguisher. You're ready. Instead of, you don't want to get ready, you want to stay ready
Mm-hmm.
for these types of things. And healthcare crises come up very unexpectedly, which is why preparing can just put you in a proactive and readiness state that can be so important.
Yeah.
Um, Lots of, another example, some, you might know this better than I would, but some lawyers will refuse to create a will for someone under duress, because they just don't know if they're in a state of mind to make these decisions, whether it's a competency issue or just the amount of stress that they're under, if creating such a document like that. So having that well ahead of time, um, is really important. And some lawyers might charge a crisis fee, or, some
Yeah.
type of extra fee to come to the hospital to create those documents. And so all of this is just additional costs,
Mm.
to somebody when you're trying to do something emergently. And, when you're fighting for your life in the ICU, you really don't want to have to worry about getting your will done, or
No.
you don't want to have to worry about, oh, does my wife have access to our banking, things like that. You want all of that to be ready. And, you don't have to have a high risk lifestyle or a advanced health issue, to wind up in an ICU. It could be a blood infection. It could be crossing the street and getting hit by a car. It could be a malfunctioning appliance that results in a home fire. It could be, any type of things. And so I just really feel it's so important to, take the time to uh, complete those documents ahead of time if you can.
Exactly, exactly. So medical decisions, I mean, they're incredibly personal. Like I've worked with couples who have completely different views on medical interventions. So just because you're married to someone doesn't mean you guys think the same, right? So even within a family, there's going to be either conflicts directly or just very differing views on medical interventions. So have you experienced situations where a client's family or their support system don't agree with the choices that the initial client of yours has made? And how do you navigate that? How do you support your client, the person who's actually paying you to help them? And then how do you support their family or support system with this, differing point of view?
It hasn't happened with me in this business yet. And but I'm ready for that conversation when it happens, and that is to remind Ontarians of the law of, the Health Decisions Act and Substitute Decisions Act, and making sure that, the last known wish is what we really have to respect. And that's even more important of making a argument of putting these plans in writing. Recalling information when you're in crisis or shock in an ICU is very, very challenging. And so you want these things written down, so that can be clearly accessed. Print them off. You don't want to have it in a file somewhere on your phone or in your computer that may not be easily accessed. You want it printed, accessible, ready to go with your will if anything happens. But as a nurse, certainly there were differences of opinion, specifically when it came to organ donation.
Okay.
So the patient would register as an organ donor, and the registration would say that this is consenting their wish,
Right.
or they're registering their wish.
Yeah.
It wasn't, you have to have consent at the time organ donation is offered as a treatment. And families sometimes would say, no, my loved one has suffered enough. We don't want to pursue this. And, then you're stuck in a position where that the patient has opted into the organ donation system and, wanted to, because it's not an opt-out system as in other provinces. People have to, really be mindful when they're renewing their driver's licenses to opt in. And so knowing that, and then having, this very wonderful thing, not being honored in their, as their last wish, that didn't sit well with me. And so part of that experience that was recurrent in Ontario and in Newfoundland just really gave me more resolve to ensure that we're capturing the wishes. And if they wish not to donate their organs, that's great too. We honor whatever it is that they want, but really knowing that person's wishes to tailor the care, customize their order, as Dr. Myers said yesterday, as one of the 7 keys. It's really, really, it's such a loving gesture for person-centered care.
And some people might say, oh, there's clauses in my power of attorney for personal care. Those clauses are so generic. It's basically like, keep me alive if I'm going to have a good quality of life or not. Well, quality of life is subjective. Keeping me alive, like it's not specific enough. Now, I know there are people that have used platforms like PlanWell Guide, who's one of our trusted partners, which goes into very much more specific medical detailing. Now, the best thing to do is to really have the lawyer who's drafting your power of attorney reference the existing advanced care plan or the letter to the doctor or whatever, the DNR, like actually reference it in the formal legal document. Because I should say that an advanced care plan is not a legal document. But if it gets referenced in the power of attorney, I've heard and read some case law, and again, stating here, I'm not a lawyer, but I've read some case law where people didn't follow an advanced care plan or whatever it was at the time, even though it was referenced in a power of attorney. And so it's up in the air as to whether or not it can really bind your attorney for personal care to do something. But I think that in most cases, if a person has, as you said, have the forethought to take the time to detail what they want, whether it's in a legally binding document or not, most families are going to wrap their head around that when they see that it's been done. Right? Most people aren't going to start fighting each other. They're going to go, wow, dad was really clear, and I'm not a fan of this, but he was very clear. And my brother is power of attorney for personal care. He should really do what's written here, right? But it is the best. I know I've heard other estate planning lawyers say this. It's great if you can do the advanced care plan and then get the legal document done, because they can reference the date of the plan, all these things in the document. So it's something to really do in tandem with whatever estate planning lawyer you're dealing with. Like, do your advanced care plan with someone like you or me, and then go to the lawyer and get that legal document done, and it can be referenced in that way. So then you're just, whether everything works out in the end or not, because we'll never ever know for sure, at least you know you're just like setting yourself up for as much success as possible, right? By doing things in that way.
For sure. And I think what's even more important, and what I recommend to all my clients, is writing it down isn't enough. You definitely have to schedule a time with your decision makers and your family to explain, go through your advanced care plan page by page and say, I intentionally went through this process. It means a lot to me. These are my wishes, and here's why. Do you have any questions? And, engage in that warm handover, because, people will remember. They won't necessarily remember everything you said, but they'll remember the environment, that conversation over the kitchen table, or whatever, at the cottage, wherever this conversation might take place. They'll remember the emotions around that. And that emotional memory can also tie into, more patient-centered decision making in tandem with the written plan. And so, I've seen it where somebody has taken time to create their advance directive, but still they said, I don't know who they talked to about this. They never talked to me. They never said that they didn't want to be on a ventilator.
Right.
Like, how can I trust this? And so having that meaningful exchange can just really deepen that relationship within a family as well.
Exactly. And I think too, just because of the differing views in our society, and I would say even particularly at this specific point in time, something that I know we really advocate for is when family meetings happen, like when we host them at Viive, we record everything. And that's the litigation law clerk in me wanting to have evidence for everything that has taken place at all times. But that can also be helpful too if there's ever a conflict between adult children or family members, is being like, no, you were there and you heard mom say the same thing as me. And making sure that that gets detailed. There's too many people out there who say that things are forged, right? But you can't argue with everyone's face on a screen hearing the same thing together. So there's definitely benefits to making recordings of things as well. Also, something we really talk about a lot, a phrase that we use, is that I'm going to say it wrong, the intention is paramount to the medium. So the idea that sitting down and talking to people about end of life is, I would say, probably for the vast majority of families in Canada, not something that they're comfortable doing. And that's fine. We will slowly work over time to change that. But figuring out how you have difficult conversations in general, like how has your family done that with anything else? I always say, how did you have the sex talk with your kids? Because, you might as well do that in the same way. We're just talking about another major life event here. So I think that sometimes communicating, it's easier to do it over Zoom. You just aren't in the same room with the person. I've had people who've written letters, handwritten letters to their children and sent it. And so long as things are kept and you write a date of when that letter was sent out and it's kept in an organized way, I think it can still really provide that security if needed down the line. But in the end, whatever form of communication is going to be best for your family is really what's best for them and for you. And you don't have to feel like you have to sit in a room awkwardly and talk if it's just not going to work for you guys. So find what's going to work best in the long run, because communication is what's most important. How you do it is really up in the air.
For sure. And having those soft skills of working with families in crisis can be really, really vital. And I just noticed there was a question in the chat from Charlene Health Services. What are some tips you have for dealing with disgruntled adult children when it comes to planning? And, one thing that I recognize very quickly is when somebody's angry or disgruntled, it's usually from fear, a lack of understanding, or seeking connection And so really kind of coming in from an approach with love and understanding to say, hey, what I'm sensing that, you're feeling a certain way about the situation, and I'd really like to talk about it with you. And, I want to hear everything that's going on in your mind. I'm here to listen, and I'm here for you. I think, finding there's a saying that we had in the pandemic was connect before you direct. You can't give somebody marching orders until you create that space of comfort. And so I've really adopted that in all aspects of my life. And trying to connect with them first can be so vital. And then you give them information to direct them in the outcome that you're hoping for. But I do think that fear, anger, it's all part of the stages of grief and loss that's coming from something. It doesn't have to necessarily either be an illness. Grief and loss can come from, retirement, the change in your roles. And it can come in all kinds of different ways, even a diagnosis of something as mild as, some heart disease. You've lost that sense of healthy status that you once had. So
Exactly. It's something that we definitely talk about as well. I think you said it, and then the person here has commented, right? Connect before you correct. And then really you do need to imagine, what if that connection can't happen? Like, what if the person is just so obstinate and won't cooperate, won't spend the time to have that conversation? And, something I say to parents all the time of adult children is, the hardest thing for you to realize is is that your kid isn't a great person. Like that at the end of the day, they might just not be. And it's hard not to take that as a personal reflection on yourself. But there are so many things that change the person that your child becomes when you stop actively parenting them at the age of 18. And sometimes that's a spouse, someone that they've married who's come into their life. And when you try and then try and then try again, and if they don't come back to you, that's a really clear sign that something is broken. And you can choose to take the time to attempt to fix that. But there also comes a point in time where in your aging and end-of-life planning, advanced care planning, whatever you call it, you have to in some ways cut your losses and go, no, this person doesn't get to be a part of this. This person isn't giving me the time of day, so they don't get to have a say in what happens. They don't get to hear things. It's important to also know that eventually you have to stop and go, just because we're family doesn't mean that you get to have a position of power, that you get to be a part of a conversation, because you're not giving me something back. Intimate relationships have to be two ways. And I think that, unfortunately, coming from the litigation side of things, that's something that people do their most to avoid. But you can't avoid a disgruntled child. Like, they're either going to find a way to heal or they're not. And if they're not, then you have to turn selfish and inward and go, I have to do what's right for me. Because holding on to them, keeping them involved in things, causing rifts between all of your children who might be doing things together, can actually make an advanced care plan in some cases useless and more stressful. So it's important to take the time, but then also be ready to cut ties if you have to, for your own health and well-being.
yeah, and I think that boundaries is a big conversation that we're having these days, and I truly believe boundaries is a form of self-care.
Yes.
And if you have somebody who is not listening or violating those boundaries, then it's more about them than it is about you. And so you don't have to. I was listening to a podcast yesterday. It said a boundary isn't a wall you put up. It's a bridge to other people to teach them how you want to be treated.
That's nice.
And letting in the people who, are going to be respecting that boundary.
Right.
And so it's not a wall, it's a bridge. And I think that boundaries get a negative connotation where you really have to cut people off. I don't think, you can really narrow who accesses you and your energy. And especially in times of illness, and you really need to focus your energy on healing and the treatment. And so if somebody is not supporting you, you limit your access to them. You don't have to cut them off, but and that's probably, I see it more as grief. That's all grief on their part that they need help navigating. And probably for parents, they take it out on their parents.
Yeah, for sure. I do see there's another question, but we really do have to wrap up. We've gone over here. So when this video gets posted, if you have any more questions, please put them in the chat, in the comment section, and either myself or Carly will get back to you. Thank you so much to everyone who was here today with all of their active comments and questions. That was so awesome. And thank you so much, Carly, for joining us. I really appreciate you taking the time, and I'm so glad we got to spend Advanced Care Planning Day together.
It was so good. Thank you so much, Mallory. I hope you have a great day.
Awesome. Bye, everybody.